Everybody, and welcome to this morning's special Angus IJB, and I hope everybody's well this morning. Just before we start, so members of the IJB and consultees have been advised that the report to this special meeting of the board in respect of internal care homes future delivery arrangements will now be considered at the meeting of the IJB on the 23rd of February. And the reason for this is to allow recently received information to be appropriately considered by the officers and, if necessary or relevant, incorporated into the report to ensure that members are fully informed when considering this matter. So I thought I would just let you know that at the start, but I know an email communication did go out previously. So we'll move on to the remaining items in the agenda. First of all, we've got apologies. Karen.
Thanks, Chair. We have apologies from Councillor Bell, Dr. Richard Humble, Sarah Dickey, she's sub today with Karen Fletcher, and Gillian Galloway, her proxy member today is Sally Wilson.
Okay, that's great, thank you. And do we have any declarations of interest? No, don't see any hands up. Okay, so we'll move on to item 3 in the agenda, which is the Adult Protection SCR P19. And I'll hand over to George for this one.
Thanks, Emma Jane. I'll provide a bit of context first of all, I think. So members will remember receiving a briefing about SCR P19 back in the autumn. Sadly, P19 died in late 2018, and there was an initial case review conducted by the Angus Adult Protection Committee. And an initial case review can decide whether or not matters should proceed to a full significant case review in SCR, and that's usually a decision, about the seriousness of the situation. It's nearly always the case that it goes to an SCR if there's a death of somebody who's subject of adult protection proceedings, as P19 was, and at other times it can happen where we have what would be regarded as a near miss. So the decision was decided to proceed to an SCR. And that was commissioned, and I have attached as an appendix the PowerPoint presentation that Fiona Rennie delivered back in November for reference. What that means is that people like myself, who I'm the vice chair of the Adult Protection Committee and the lead for the Partnership on Adult Protection. So if you're in that position, you get early sight of the concerns. You get to see those at the initial case review stage. And that means that you can start work pretty well straight away on any immediately pressing concerns and high-risk things that need to be fixed quickly. There were one or two of those, and we were able to do that. But for the vast majority of people, because of the rules of confidentiality around SCRs, they don't see the SCR until it's published. So in a way, that explains why, if you look at the improvement plan, it looks very bitty and as if things are at different stages, and that is correct because some of the things we were able to make start on straight away, but other things, people who were tasked to carry out the tasks have only had those since late November, and we had the Christmas period in the way of that. But over time, that'll all start to even out. The tasks will all start to fit a lot more sequentially. So the SCR was published, as I say, on the 25th of November 2021. We obviously it had a lot of recommendations, 56 I think from memory. It's in the report. And we started work pretty quickly on looking at those and developing an improvement action plan. It's multi-agency. It's overseen by the Adult Protection Committee and the Chief Officers Group, and those are the rules, if you like, within the Scottish Government's regulation and national guidance for SCRs. But the IJB also has a role in that, because the functions that previously sat with the council prior to integration were delegated to the IJBs at the point of integration. So those are the elements of the Adult Support and Protection Act 2007. So hence the recommendation that the IJB scrutinise and approve the content of the improvement plan. I think the report, the improvement plan does look and feel like half-finished work. Obviously, there's a few weeks in the process since that report has been submitted to this group, and indeed we've been doing an update on the improvement plan this week, and it already looks quite different. It's being reviewed about every 10 days at the moment. So I think seeing further iterations of that along the road will have a more kind of satisfying feel, I think. Unusually, the Scottish Government has been very interested in this SCR. I've been involved in SCRs in child protection work, adult protection and MAPA, and I've never known the Scottish Government to be so interested in an SCR. I'm not quite sure why that is, but that's the state of play, and they've issued what's called a commission, offering jointly with HIS and the Care Inspectorate to provide support and also oversight and scrutiny of the improvement plan. There's a debate going on and a lot of discussion in meetings between the Chief Officers Group members and the Scottish Government about how that support and scrutiny should look, and that work is not yet concluded and is still ongoing. So we have, however, agreed some reporting timescales with the Scottish Government. They're in the report, but just to remind you. So the first thing was that status report on the improvement actions that had commenced earlier in the process should be submitted by mid-January, and we've done that, and that's in. The second thing is a process and future plan for wider improvements to be in place by the end of January 2022. So that's we've all been working on that. That's the latest update. I think we're just a few days behind, but that's more or less ready to go. And a full work plan to be in place by the end of February 2022. And included in that will be a prioritisation system for the actions. There are so many actions, and a lot of them are quite complex and involve different agencies, kind of multifaceted, and they would need to be stepped, a number of them. They're not quick fixes. So we've been working on that, on a kind of prioritisation scheme. I think that's probably about all I need to say about it. Yeah, I think so. Thanks, Chair.
That's George. I think I'll just make a start. I think it's obviously very important for us as the IJB to be very clear in terms of the governance and our role in terms of the oversight for the improvement plan. Can you just confirm, George, that the plan that's presented, the same action plan is the same one used for all of the agencies that are involved?
Yeah, that's the case, Imogen. Yeah.
And I think also it's a big plan, obviously, quite unwieldy in many ways. Will there be plans for sort of a prioritisation exercise in terms of the actions within that plan, sort of red, amber, green kind of system?
Yeah, we were just talking about that yesterday, actually. So I think where we're going to get to, we haven't quite finalised it, is it's a kind of priority 1 will be within the first 6 months, priority 2 within the first year, a priority 3 maybe extending into year 2, and the type of thing that would fit into that third category would be really improvement actions that are national almost. So things like improving the IT interoperability between the different systems. Now, the Scottish Government has said if there are things that you would like our support with that you think are more national issues, list those for us, and we've done that. So that's one of them. We can't fix that. Some of the systems are national systems, and they certainly extend beyond Angus. So they're the kind of things I think that would be in year 2. I would also want to offer a bit of assurance to the group. You know, it's 3 years since the death, and we've done a lot in that time. And you'll remember from previous reports, I asked for a large-scale audit to be undertaken in the partnership with our adult protection work, and we looked at 96 cases. That's a big audit, and that was overwhelmingly positive. Yes, there were a number of things we wanted to improve on and tighten up on, but you know, I wanted that assurance that, you know, SCRP 19 didn't indicate a general malaise in adult protection work, and it didn't indicate that. So that was reassuring. And there's a bit of overlap between these two pieces of work as well.
Okay, that's I see a few hands are up. I'm going to bring in Gail first, and then I'll bring in Peter and Andrew. So Gail.
Thank you, Chair. Just to add to what George is saying, the COG, the Chief Officers Group, met last week on the 26th of January, and we also considered the report. And just to confirm that Phil Davidson, who was the chair up until the most recent meeting of the COG, and Ewan West as the chair of the Adult Protection Committee in Angus, have a meeting with the Minister on Tuesday, the 8th of February. And as George says, that's for the Minister for Mental Health and Wellbeing and Social Care. He's asked for an update on the progress with implementing the recommendations from P19. The draft commission that we received, George is quite right, a particular area of challenge. We're still in discussion with them that still requires clarity. But Healthcare Improvement Scotland and the Care Inspectorate for Independent Assurance and Improvement Support have been commissioned to support us there. What we need to agree is exactly with what and how what, and the governance around that needs to be made much clearer. The intention of the meeting on the 8th is to update the Minister on the recommendations that have already been implemented. As George says, many of them are multifaceted and involve many agencies. The other part is the priorities for recommendation and what we've still got to do. And my understanding is Angus Health and Social Care Partnership alone has 20 standalone recommendation action points that we're currently working on. And then obviously to provide them with progress with finalising the wider implementation plan as George describes. So an immense amount of work is taking place.
That's very helpful. Thanks for that extra information, Gail. Peter.
Yeah, thanks, Chair. Thanks for the background, George. That's really helpful. Just 2 points, and I think Emma Jane sort of touched on it. I was wondering if this report was going to be presented in the red, amber, green format. The only other point I was going to make, and I know this is very much work in progress, is that there are a large number of action points that don't have a date, a set date for completion. I wondered if and when that would happen.
Thanks, Peter. Yeah, we're working on all the timescales just now. I saw a reminder from Nikki McNamee, who's doing a lot of legwork on it, and Abby Jackson should probably deserve a mention too, prompting people to get their timescales set against them. So that's a work in progress as well.
Good.
Andrew?
Thanks, Chair. I'm quite encouraged by the amount of activity that's going on with this. The governance seems to be in place, but I'd like to make a comment about the operational side of things. As been mentioned several times before, there seem to be many agencies involved. I kind of lost count when I was trying to list them. I lost count about 15, I think. Clearly, some of those agencies have a direct involvement and other ones are there kind of like for information only, I guess. Maybe I'm wrong. But my simplistic view of the whole thing is that there's maybe the complexity of all the links of communication maybe stand in the way of the solution. I think there should be, is there one key agency that has the duty to keep an eye on P19, or there's a danger that everybody thinks it's somebody else's job. That was my key feeling to, great, everybody's involved, everybody's running around, everybody's looking for action items, but who is the person that should have been flagging this up? And I don't see that anywhere in the plan. Maybe it's there, but I can't see it. Could you maybe like point me in the right direction, George, please?
Yeah, thanks, Sandra. So the Adult Support and Protection Act names the council as the lead agency for adult protection, and it has a whole load of specified duties in relation to that. That what's called council officers have to undertake, and that act was in 2007, and it also stipulates that the Adult Protection Committee is the strategic body for overseeing adult protection work in each area, and there's a duty to have an Adult Protection Committee in every area. The other professional bodies are what's called duty to cooperate agencies. That's how they're entitled. So that lists people like the police and NHS as they have a duty to cooperate, and they have to cooperate with the council's lead agency in undertaking adult protection investigations, and also in any strategic work that the Adult Protection Committee asks of them. So the lead agency was, I suppose, the council. It gets slightly greyer because under delegation, those functions in the Adult Support Protection Act were delegated to the IJB, of which the operational wing is the partnership, of course. So in my view of that, and I don't know if David Thompson's on the call, he might have a different take, that in essence means that the Health and Social Care Partnership is the lead, and I think we would accept that we are. And when an investigation is undertaken, that's led by staff from the Health and Social Care Partnership. A case that is subject of adult protection procedures, the lead worker is a member of one of our teams, either in older people's services or disability services, mental health or radars, whatever. And we have the duty to convene the core group meetings. So anybody who is registered, if you like, within the adult protection system, their case is core group meetings when the professional group involved, there's always a group of people providing the services and the support and managing the risk, all meet periodically. And the rules about how those are conducted, and in fact we've changed that a couple of bits as a result of this case. That group also has to consider, for example, whether emergency measures will be applied from the courts, you know. So that's how it works. Andrew, does that help?
Yeah, explain a bit about how the organisation is structured and whose principal responsibility it is. But and like in all these cases and historical ones in the past with other incidents of this sort, it just seems to be that somebody, whether it's a neighbour or passerby or somebody, must spot these things. And what's being done to kind of encourage people not to say, "Oh, I haven't seen this person for 2 weeks." You know, I know it's. I think he was. It's just
very visible.
Simple common sense, you know.
Yeah. To my way of thinking, as I say, having been involved in a lot of SCRs, that for me, it's usually a combination of events coming together in a unique kind of way, and often, if only one or two events had been different, then it might not have resulted in such a bad outcome. That's my experience of them. One or two changes would have made a great deal of difference.
Okay, thanks very much, Andrea. I think that was a really good question, and it was good to hear some clarification from George in that area in particular. Alison?
Yeah, I just wanted to build on what George is saying around the clinical aspects. So there's some aspects of this gentleman's journey that were around adult protection, but there is crossover with some of the way that we're managing things clinically. And I just want to provide assurances that we are looking at all the issues with NHS Tayside through our Angus Clinical Partnership Group, but also linking in with primary care across Tayside, trying to develop ways of working that are consistent across Tayside where appropriate, or within Angus where appropriate, so that everybody knows the referral pathways, capacity assessment. So there's a series of actions that relate to health, and I just want to give that commitment that we are going to be looking at that through our Angus Clinical Partnership Group, which is multi-professional but includes general practice, who historically it's been difficult as GPs are independent contractors to have them involved necessarily within the partnership services aspects. We can't mandate things very often, but we can certainly work together, and there is a commitment across general practice to support this piece of work.
That's very helpful. Thank you very much for that, Alison. Do we have any other comments or questions before moving to the recommendations? Yep, Councillor Speed.
Yep, thanks, Emma-Jane. Sorry, I think that's me now. Thank you. Yeah, it was just to kind of pick up a little bit on what Andrew Jack was saying, just around kind of the complexities and perhaps simple solutions. I mean, I think, we would all agree this is a really horrific case, and as George says, work's been going on for the last few years in terms of making improvements. But I just, looking at the report, there's just a few things that kind of really stood out for me, and I'll not go through them all, but just, one bullet point, the reviewers recognised the efforts that Hillcrest staff went to in their efforts to support P19, and that included their persistence to escalate concerns to health professionals and managers. Assumptions were made by services about alcohol misuse being the cause of P19's physical ill health and non-engagement. Just very simple things in terms of, clearly there was, people not listening, assumptions, these are kind of basic kind of health and social care kind of values that, we would look to apply. And it just, absolutely we need to make sure that this is a thorough piece of work and all the recommendation and action plans and points are carried through. But in many ways it feels like there's kind of more simplistic things that can be done, in the here and now, and should have been being done, if that makes sense. Emma-Jane, it's just,
Yeah,
just
no,
don't want to, for situations to get lost in all these processes and systems when perhaps just everyday solutions are there, and that's just everybody doing their bit to check in and keep an eye and listen when things are being raised.
Yeah, I think that's a very good point, Lois. Alison?
Yes, I agree with you, Lois. And one of the key things for me is that as a system, we reflect these values of person-centeredness and don't have boundaries in our services that are dependent on your age, which we're really working hard to remove any perception that enhanced community support is only for older people, but also that we have bespoke services that meet the needs of particular groups. So it's just trying to, within our services, remove these artificial boundaries. It should be based on how your service can meet an individual's need. And hopefully if we get the values right across the whole system at every level, then that will reflect and we will have staff and other people that work with us with the same values that we have it's about the person. How do we meet the person as an individual's needs? So I have that on the recommendations for our clinical partnership group this month. How do we make sure that we know that there's no boundary based on age and that we, or any other particular characteristic?
Yeah, I think something else that I kind of in kind of earlier briefings was that I kind of felt that there was a lot of emphasis on kind of the alcohol misuse and the later stages of his diagnosis in terms of the bowel cancer, but just had concerns around actually his kind of his primary diagnosis of multiple sclerosis, and just wondered whether as well there was enough kind of understanding by everyone around, specific diagnoses. Again, regardless of that, it is about the person, as you've just said. But yeah, that was just another comment that I kind of had noted earlier.
Alison?
Again, I agree with you, Councillor Speed. This is something I picked up with somebody that has an interest in neurological conditions just because of things that I'm interested in within general practice, and I picked up that there wasn't a strong theme around the clinical aspects of multiple sclerosis, and that's perhaps because it's an adult protection thing, but there are very important relevance between people with a neurological diagnosis, the crossover with cognitive impairment, and we need to get that right, not look at diseases in single systems, but also meet needs. We have got the neurological ECS, which we had already been working on, and that involves linking with the Breakthrough Collaborative within NHS Tayside, looking at how we work differently for people with neurological conditions. What this has involved, starting in Angus with multiple sclerosis, now extending to Huntington's disease, and going with P&K and other partnerships being involved and linked with this. It involves the community nursing service meeting with the specialist nurses, with the patient, and we have done some initial work that has indicated that we are not working together closely enough, and the initial conversations, a very person-centred approach to planning care, so not necessarily even anticipatory care planning, just looking at the whole system. That will allow us to map what we did for these people and whether there's any gaps in our services. So, for example, it might be that we need more polypharmacy reviews, it might be that we need more support with continence, it might be seizures, it might be carer support. Whatever comes out of it, we'll be able to map and hopefully align our resources within the community to meet the needs of the younger person. And there's a lot on the older person, and that's fine, but how do we meet what are the individual needs? And that's looking at data such as the out of hours presentations, whether there's a need for lots of outpatient clinics, if we have the nursing able to access the support, liaising with the specialist. So we will look at all of that. That's been led by Derek Tasker, and that was through Scottish Government funding.
Okay, thank you. Thanks, Emma-Jane.
Gail, did you want to come in?
I'm glad Alison brought that piece of work that we're leading the way in Angus there. Thank you, Alison. I'm actually the Chief Officer's representative on the Neurological Conditions National Advisory Group. So we're really excited to be taking that piece of work forward, Lois, and they're doing very well. And as Alison says, it's looking at much more of improvements at a much earlier stage for people with a diagnosis of MS and now, as Alison says, Huntington's. So that's a really exciting piece of work that actually will be reported back nationally as well.
Okay, thanks for that.
Okay, do we have any other questions or comments before we move to the recommendations in the paper? No. No. Okay, so the recommendations, well, you'll have seen them at the start of the paper: to review and scrutinise the Adult Protection Committee Significant Case Review P19, to review and scrutinise the initial improvement actions detailed for Angus Council and Angus HSCP, the priority attached to these and the capacity being made available to progress these, to note the ongoing work of the Adult Protection Committee partners to finalise a multi-agency improvement plan in response to the SCR and the complex and detailed nature of the work taking place, and finally to agree to receive a further report detailing progress made against actions in autumn 2022, so later on this year. Are we all happy with those recommendations? Yep, I see nodding. Just on that, in terms of that final, or the report that's coming in autumn, do we have any idea about how, following that report, how frequently the reports would come to the IJB, George, or is that maybe one to decide whenever we get closer to the time?
Yeah, probably one to decide. I think it just depends how well things have progressed at that point, probably, Emma-Jane. Okay, so we're all happy with those recommendations. That's great. Thank you very much, everybody, for all of your comments and questions. It's clear a huge amount of work is happening in that area, and that's really good to hear all of it and to have it presented in the paper as well. So thanks to everyone involved with that. So that actually brings us to the end of our meeting today. Thank you very much, everybody, for joining, and we will see you on the 23rd of February at the next IJB.
Thank you.
Thank you, Chair.